30.
Well, teachers become eligible to book COVID-19 vaccine appointments in Massachusetts next Thursday. Here to answer your questions, Dr. Kristen Moffitt, an infectious disease specialist at Boston Children's Hospital. Dr. Moffitt, good to see you.
Good to see you too.
So hopefully we will soon have a situation where all of the adults at a school are vaccinated, but none of the kids are. So will classrooms be safer if no kids are vaccinated?
So the data really show that with masking and distancing and all the protocols that have already been in place, that classrooms already are safe. But teachers and staff who are eligible for the vaccine should absolutely be prioritized for vaccination. And this will just add one additional layer of safety to those individuals who get vaccinated and to keeping our classroom safe.
Governor Baker has said that he would like elementary students across the state back in school full-time by the beginning of April. So do you have any concerns about the number of kids that could then end up in one classroom? This goes to that whole, 6 feet of distance versus 3 feet of distance. It's really not practical, I think, in a class of 20 or 25 kids to do 6 feet in many classrooms, or whether they'll eat lunch indoors or in a cafeteria. So I guess the question here is, what questions should parents be asking?
Yeah, the classroom capacities, just as you said, will really be determined by the availability of spacing between students and teachers. And every school is thinking very hard about this right now. Certainly 6 feet when it's possible is best, but there are strong data that even at 3 feet of distance, when everyone's masked and with good ventilation, that transmission still is very low. All schools are also thinking about whether or not in-school lunches are feasible and how to do this safely. Certainly students would be unmasked, which could be a risk. But there are many examples of K through 12 schools, and especially at the elementary level, that have been doing lunches safely. So outdoor lunches would be best, but this is New England, it may not be feasible yet. Indoors with good ventilation and spacing is still likely to be very safe if they can avoid having students together in large numbers in spaces like cafeterias. So parents should certainly be asking about what the plans for school lunches would be.
Let's hope that New England spring cooperates. All right, in a typical year, we'd be asking you about the flu this season. So has children seen a drop in flu cases? And how does the number of patients that you've seen this year compare to last year with the flu?
Yeah, so Boston Children's has seen only very rare cases of influenza, and that's actually been true at children's hospitals throughout the nation. For example, this year we've seen influenza cases in the single digits, when most winter seasons we see them in the hundreds. So it's really remarkable.
Another sign, I think, that masks do work. All right, Dr. Kristen Moffitt with Boston Children's Hospital, good to see you. Thanks for your time.
Sure, thanks for having me.
The clock is ticking.